So good morning, everybody, and welcome back to Security Health Plan Academy, our monthly webinar series created to provide you with information relevant to your health, wellness, and healthcare plan. Today's presentation will focus on Security Health Plan's Medication Therapy Management Program and how this program can help you to manage your medications and any associated side effects and possible drug interactions. Our medication therapy management program may also help you to find lower cost alternatives for your current prescriptions. Today, we are fortunate to have Security Health Plan Clinical Pharmacy Specialist, Kurt Wittig, to discuss this program. Kurt is a graduate of the University of Wyoming School of Pharmacy. He completed his residency with Marshfield Clinic Health System and started at the health plan, I think probably right after completing. Kurt helps to manage Security Health Plan's medication therapy management program for our Medicare Advantage Part D members, which makes him the perfect presenter for today's topic. So without further ado, Kurt, you can go ahead and get started.
Thank you, Ashley. I appreciate the introduction. I'm happy to talk about our medication therapy management program and medication therapy management in general for you all today. So first, you might be wondering, what is medication therapy management, or MTM for short? So MTM is a program where specially trained pharmacists identify high-risk patients and help them to save money, address safety concerns such as drug interactions, help ensure people are on the right medications at the right dose, and ultimately our goal is to help improve their overall quality of life. So how is this process completed? Well, it first starts with a consult, typically over the phone. Certain years we also have face-to-face visits available, but a vast majority are done telephonically. So the first step is to obviously review all medications for a given member. So this includes over-the-counter products. Lots of people don't think of over-the-counter products as part of their medication regimens, or they don't think they really have any safety concerns or anything like that, but various over-the-counter products can have effects on certain disease states or even interact with other medications. So that's always something that we like to touch base on as part of the program. And then once you have a full list, you can start looking into potential ways to assist the member or patient. So the first step would be to identify any issues with duplications. Say you're on multiple drugs that do similar effects on the body or treat similar things. You may not need to be able to take all of those. So any conflicts or drug-drug interaction between any medications, that's also something we looked at. And then we also look at any potential safety concerns. So if you're having issues with side effects or checking to see if you're on the correct dose, because there's lots of medications out there that need to have their doses adjusted based on how well the kidneys are working or how well the liver is working. So that's always something that we like to look for as part of the program as well. And then another key component of the program is looking at your medication schedule and identify if there's any missed doses for certain medications. This is what's called adherence. So we're looking to see that medications are taken as prescribed by your provider. So we looked, and if there are any missed doses, we look to see if there is a specific reason for why the dose was missed. Well, it's just general forgetfulness. Say if it's a 3 times a day drug, you might forget the middle of the day one when it's the only one you take at that time of the day. We look at if you're not taking something because of cost, we try to help address that. And then as well with the side effects, help address any of those concerns that might be leading to not taking a medication as it is recommended by your doctor. And then once that
I keep accidentally hitting my mute button, I'm not sure.
And then next up was to compile a personal medication list and action plan. We have some examples of this later on. So a summary. This is a summary of what we talked about with the pharmacist and has a complete medication list. So you can have that on hand in the future. And the medication action plan, or MAP, also includes information on everything that you discussed with the pharmacist, everything from regards to your medications, any other recommendations, and everything up to vaccines. And the last step would be to outreach your provider if needed, or a prescriber or other healthcare team members. based on what we found during the review. And if there's any follow-up that's needed, we will do that on your behalf with your permission as well. That's kind of broad picture MTM, just the general flow. And then some benefits of medication therapy management do two main things. So it helps empower patients. So it encourages patients to be active participants in their healthcare, empowering them to be more knowledgeable about and responsible for their health and medication use. So you want to be invested in your care. You don't want to be just taking medicines, not knowing what you're taking it for, what it's supposed to be helping with. And those are things that the MTM pharmacist tries to assist with. And ultimately helps to facilitate more effective partnership among patients, their pharmacists, physicians, and other healthcare providers to achieve optimum medication therapy results. And then another key component and benefit of MTM programs are they provide a value. So they contribute to the safe, appropriate, and effective use of medications and offer value by improving the quality of patient care and outcomes. So these are things like improving how well your diabetes is treated, how well your high blood pressure is treated. Again, improving adherence, so making sure you're taking your medication as prescribed. And then you also have the reduced healthcare costs. So this can come in the form of reduced visits to your provider or urgent or emergency care services, or ultimately some hospitalizations in some cases. And also by reducing medication-related adverse events or side effects. So ultimately improving patient safety. Transitioning now into MTM at Security Health Plan. So we have been providing MTM services to Security Health Plan Part D members since 2014 and expanded to assist with the dual eligible special needs populations in 2017. And there's two primary components to the program. So the big one, which is essentially what I outlined there in the first graphic, is a comprehensive medication review. So this goes through all those steps that we talked about. And we've since starting the program in 2014, we've continually grown the number of CMRs we do in a year. And last year we completed around 2,500 of these. So we do a significant amount in each year. And then the other more focused part of the MTM program is a targeted medication review or TMR. So these tend to happen on a quarterly basis or more of an as needed type intervention. So examples of this, again, looking at adherence. So if a person is not taking a blood pressure or cholesterol medicine as prescribed, they're forgetting to take it, we try to provide some education there. Or another example is members with diabetes are not taking a type of cholesterol medicine called the statin that can help prevent a heart attack or stroke. So there's another intervention that we try to key on during these targeted medication reviews. So our MTM services are provided by specially trained pharmacists. And a key thing to remember is they're offered at no additional charge to members. So the MTM pharmacist will help you get the most from your medicines, lower your risk for harmful drug interactions, find lower cost alternatives to your prescriptions if they're appropriate and if there's any available, and also help to get answers to your questions about prescriptions and over-the-counter medications. So in summary, an MTM pharmacist will go over all of your medications with you, help identify duplications or conflicts, help organize your medication schedule, ultimately helping to ensure you're getting the best results from your medications while trying to keep your out-of-pocket costs down as much as possible. So our pharmacists review medications being taken for many health conditions, including but not limited to rheumatoid arthritis, heart failure, chronic lung disorders such as COPD and asthma, depression, osteoporosis, diabetes, as well as high cholesterol or dyslipidemia and high blood pressure or hypertension. Again, these are just some of the more common ones that come up a lot. So they're a key focus, but we're happy to discuss any potential disease state a person may have during these reviews. So our Security Health Plan pharmacist team, so obviously I have myself. So I've been with Security Health a little over 6 years now, and I've been part of the MTM program since starting. So I've been happy to be part of it and help grow it over these past few years. We also have Amanda Siegler, she's another pharmacist at the health plan. She's been here close to as long as me. She's been a great help with the program as well. And then a newer pharmacist on the team is Andrew Sedlacek. She's been here about a little over a year, but she's been a great asset to the MTM program as well, and has been diving right in with reviews. So in addition, we also have our pharmacist partners at Marshfield Clinic. In typical years, they were unable to help with CMRs in 2022, but we're hoping to have them back next year. But they've always been a big part and a big help to the MTM program for Security Health. And then we also work with a company, CSS Health. They also help to assist with MTM activities when available. And they're a company that kind of manages our the back end of our MTM program here, but they're key partners with the program overall. This next slide is just a little screenshot of what the pharmacists see when they're completing these reviews. So this is a dedicated and secure platform called MTM Path. Again, this is created by our partner CSS Health. So this is just a kind of a one-stop to help our pharmacists keep everything organized. So you can see medications here, strengths, how what the directions are to take the medication is what it's used for. And then we can also see who prescribed the medication and when it was last filled. So this gives a way for the pharmacist to help drive the conversation with patients during these reviews. And then we also have the ability to focus on things like adherence, any allergies a person may have. And then we can do assessments for various diseases, again, like for high blood pressure, diabetes, high cholesterol, anything that might be a concern for a given member or patient. And then ultimately we can come up with the various recommendations for both members and providers from this platform as well. So you may be asking, how do members participate in the program? So there's a set of members that are automatically enrolled in these services if they meet these 3 criteria. So you must have 3 or more health conditions of the health conditions I listed on the previous slide. Must take 7 or more chronic or medication drugs. This is for 2022. It's going to go up to 8 in 2023. But these are medications that you take every day. So if you get an antibiotic to treat an infection just one time, that's not going to add to your list. So it's the things that are you taking for your chronic conditions. And then the last part is you have to meet a certain cost for your Part D medications. And in 2022, that was around $4,700 per year, or about $1,174 per quarter. And this is set by CMS, or the Centers for Medicare and Medicaid Services. So that, again, this changes on a yearly basis. But if you check all 3 of those boxes, members who meet these program criteria will receive an invite letter in the mail and a phone call from a pharmacy technician inviting you to participate in the program within 60 days of meeting these criteria. And the letter will have my signature on it, so you know that it's legit. And if the Marshfield Clinic is helping with these reviews next year, then signature will be on it as well for the members on their side of the program. In addition to the members that automatically qualify for the program, Security Health encourages members, if they're interested in the program or if they have any questions about the program, they can call the number here to request a review. And we also have the number listed at the end here for reference if you want to jot it down. So what's included in the review? So again, it's a phone or in-person consultation with MTM pharmacists to complete this comprehensive medication review. Generally takes about 10 to 15 minutes. So we have and it can take as long as you want it to. We've definitely had reviews take up to and over an hour. So all depends on what you're concerned about or what you want to chat with our pharmacists. They're always here to help. So it's an extensive review of medications and associated health conditions. We identify drug therapy opportunities and quality of life improvements. So again, these can be things looking at helping a member to get an in-home blood pressure or blood sugar monitor, potentially finding a pharmacy closer to home. And if there's certain drugs that you're getting through an infusion in a provider's office, they may be available to get an at-home infusion instead. So these are all kind of things that we look at a case-by-case basis to see if there's any opportunities there. And then we outreach to provider if the care opportunities are discovered. So again, these could be anything from medication recommendations to other aspects of care like overdue vaccinations. And then we have a follow-up letter that includes the written copy of your medication action plan, or MAP for short, and a personal medication list to help keep track of your medications. So in regards to the follow-up letter, we encourage you to update this information with your doctors, pharmacists, and other healthcare providers at every visit. Kind of can be treated as a living document. So if you have a medication that's stopped, you can cross it off the list. There's a few blank spots on there. If you have a new medication, you can feel free to put those on there as well. It's just helpful to have all the medication list and the things you're monitoring in one place, just for reference. You can also give copies to your family or caregivers, and you can request additional copies by calling the Security Health Plan MTM line at the end of this presentation, and also by going to the Security Health website. You can also find the MTM page there as well. So this is just a brief snippet of the medication action plan. So this is actually a several page document as created after the review, but this includes just a brief glimpse of the highlights or take home information. So for this particular example, this member was taking hydrocodone with acetaminophen or Tylenol. And a common side effect of this medication is constipation. So we talked about options that they could use to help treat symptoms of constipation. So there's various options over the counter, such as Colace, Senna, or Miralax. So these were just things that we talked about during the review, and we wanted to include in the medication action plan, so they have it as a reference. If it does become an issue later on, they can go back and look at this and see, oh, these are the options that I could to help with the constipation. Here we just have a little snippet of the personal medication list. So you can see that it also includes allergies or side effects you might have. So these are the medications that you want to avoid. And then we also have all your medications listed here, how you use it, why you use it, and who prescribed it. So if it's an over-the-counter product, it'll say self-prescribed or OTC there, but it just compiles all your medications in one place. So you have that handy document if needed. Lastly, I just want to close with a few success stories of the program. So these are some of the more high impact ways that we've been able to help over the past few years. So dealing mostly with safety and cost. So the first one, this member was prescribed Entresto, which is a medicine for heart failure, and was previously taking losartan. So Entresto is a combination drug that has two medicines in it, and you can see that the one called valsartan sounds very similar to losartan. So generally you don't want to be taking these at the same time. So during the review, the member stated he was still taking both of them, and this combination is not recommended due to increased risk for a potentially serious reaction known as angioedema. So this is when you can have swelling around the tongue or your throat. So as you can imagine, that can be pretty serious in terms of causing breathing concerns. Luckily, we were able to get to this before the member was having any significant issues, but so we recommended he was to discontinue the losartan and only take the Entresto. So after consulting with the member's provider, the member was advised to stop the losartan immediately. So in this case, we helped to prevent a possible hospitalization by preventing the serious side effect with this interaction. Another example of a safety intervention, this particular member was taking Uloric, also known as febuxostat for gout. So the FDA communicated there's an increased risk of death with febuxostat compared to allopurinol, which is another medicine to help treat gout, particularly in people with known cardiovascular disease or disease of the heart and blood vessels. So the FDA now recommends limiting the use of febuxostat to certain patients who are not treated effectively or experience severe side effects with the allopurinol, for example, if they had a rash. This particular member did not have a documented trial or intolerance to allopurinol, so we outreached the member's provider to recommend switching from the febuxostat to allopurinol. After consulting with the provider agreed, and the member was switched from the febuxostat to allopurinol, helping prevent a potential serious complication or cardiovascular event, including hospitalization and ultimately even up to death. The last success story we have is another way that we like to help members. So this one deals with cost. So the member was currently taking Tresiba insulin, which was a $100 monthly copay with increased costs when entering the coverage gap or the donut hole. If you're unfamiliar with what the coverage gap or donut hole is, this is a coverage. It's the phase of Part D coverage after your initial coverage period, and you enter this when your total drug costs, including what you and your plan have paid for your drug, reaches a certain limit. In 2022, that limit was $4,430. So while in the coverage gap, you're responsible for a percentage of the cost of your drugs instead of the set copay, like the $100 copay in this example. And for drugs that are brand name only and more expensive, switching over to that percentage can be pretty shocking for members when they get into that gap there. So knowing we had some alternatives available in this case, we recommended the member switch from Tresiba to Lantus insulin. So after consulting with the member's provider again, the member was switched from Tresiba to the Lantus, which helped provide an immediate cost savings because in this case, Lantus is part of the senior savings model at Security Health, and monthly copays are capped at $35 for certain insulin products through all phases of coverage, including the coverage gap. So even if you're on a brand name only drug, it's capped in this. The monthly cost is capped in these cases, so you won't see the spike when you enter the coverage gap. This member was very appreciative of that recommendation. And then in closing, we just have some additional information on our website here. Again, this is the link that I mentioned previously. And there's also a video up here with another pharmacist at Security Health that I mentioned before, Amanda. She does a great job going through the program, and it's about 8 minutes long if you want to get to know Amanda a little bit before potentially calling in to have a review completed. And then lastly, I just wanted to leave the MTM phone number here. So this is our dedicated number for medication therapy management questions, any issues you might have, or if you want to request to schedule an appointment. This is the number you can call, and it'll go directly to one of the technicians we have monitoring this phone line. And with that, I'll open it up for questions.
All right. Thank you so much, Kurt. And I love those examples because it really shows how important this program is and how big of a difference it makes. I do want to remind our guests on today's call that you're welcome to submit a question via the chat feature, which is located at the bottom of your screen. I did have some questions, though, that were submitted in advance, so we'll tackle those first. The first question is, can you have more than one CMR in a year?
Yes, so typically we try to have one a year for everybody that's eligible, but if you've had one at some point in the year and have any follow-up questions or any of your medicines have changed, we certainly welcome any callback in those cases. And feel free to call in and we can definitely do a review again or just tackle whatever any issue that you might be having or concerned about there. So no limit on that.
Okay. The second question that was submitted was, if someone reaches out to me about an MTM review by phone, how do I know it's not a scam?
So that's a great question. A lot of when we're outreaching members, we do have some people that are skeptical because there are a lot of scams out there. But if you're ever wondering specifically whether this offer is from Security Health, we recommend calling the number here that's listed, the dedicated Security Health MTM number, and then we can just look at it to see if it was us that was outreaching or if it was fraudulent in that case. But that's the best way to figure out one way or the other.
Darn scammers, there's so many, it's so hard to tell.
Right.
Another question we had that was submitted, I think this is a great one. If I don't have Part D coverage with my Security Health plan coverage, can I still get a medication review?
Yep. So in those cases, again, we're definitely happy to have that conversation about a medication review. But one of the technical aspects of how these works, if you don't have Part D, you're not in our dedicated platform that I mentioned earlier. So you won't get the full medication action plan printed and medication list in that format sent out, but we can put together something a little more custom for you if you're looking for any sort of summary document after the fact. But yeah, even people that don't have Part D can have these reviews completed if they want.
Perfect. Well, I didn't see any others come through the chat feature, so we can give you a few minutes back in your day. I will say to anyone that is on the call or watches this presentation following, you're welcome to submit a question at any point, and we will get it to the right person to answer. So don't hesitate to submit a question, even if you watch it after today's live event. So with that, thank you so much, Kurt, for joining us, and be well, everyone.
Thank you.